Greetings to all honorable judges and fellow participants of the International Medical Student Research Conference 2024. My name is Kenoah Kovara from the Faculty of Medicine, University of Indonesia, and today I would like to present our study with the title of Exploring the Potential of Xanomeline on Trospium Chloride for Schizophrenia Patients, a Systematic Review and Meta-Analysis. For the introduction, schizophrenia is a significant global health concern, affecting approximately 1 in 300 individuals worldwide. Alarmingly, the prevalence of this condition has surged by more than 50% over the past 2 decades, underscoring its growing impact. The lack of effective treatment options is a critical issue, as untreated schizophrenia increases the likelihood of premature mortality by 2 to 3 times. Currently, the standard treatment for schizophrenia involves the use of dopamine antagonists and partial dopamine agonists, which function by inhibiting dopamine activity. While effective to some extent, these treatments are associated with serious adverse effects, including tardive dyskinesia, weight gain, and Parkinsonism, with some side effects proving to be irreversible. Emerging as a potential alternative is xanomeline trospium chloride, also known as CAR-XT. Unlike traditional dopamine-based therapies, xanomeline targets muscarinic receptors, acting as a muscarinic agonist to alleviate symptoms of schizophrenia. To counteract the cholinergic side effects associated with xanomeline, it is paired with trospium chloride. This study is designed to evaluate the efficacy and safety of CAR-XT compared to standard dopamine-based therapies. The Positive and Negative Syndrome Scale, or PNSS, will be utilized to measure changes in schizophrenic symptoms. By analyzing these results, the study aims to determine whether CAR-XT represents a safer and more effective treatment option for managing schizophrenia. We carried out a meta-analysis consisting of randomized controlled trials. The literature review search was conducted using several databases, such as PubMed, Scopus, Cochrane, and clinicaltrials.gov. To assess the potential bias, we used the Cochrane tool ROB 2.0 to analyze the risk of bias. We also assessed a random effects model and a fixed effect model to pool effect size through the meta package in the R programming language. Our inclusion criteria are RCT studies with adult patients suffering from DSM-5 schizophrenia, with the intervention being xanomeline and trospium chloride, or CAR-XT, whereas our exclusion criteria includes studies without available full text, not in English, and without complete outcomes. Through literature searching, we found 4 randomized controlled trials encompassing 822 patients in 2 countries, assessing the safety, tolerability, and efficacy of CAR-XT in treating schizophrenia symptoms. As for the result of the risk of bias assessment, all studies reported low risk of bias. As a scale that is frequently used in assessing drug treatments to determine the changes in symptom severity of schizophrenia, the Positive and Negative Syndrome Scale, or PNSS, total score was assessed between the treatment and control group, where it shows that CAR-XT has proved to decrease the PNSS total score much more significantly compared to the placebo group, indicating the drug's effectiveness. However, this result presented a high heterogeneity level of an I-square score of 97%. To justify that, we conducted a meta-regression test in the form of bubble plots and found that diversity in publication year, sample size, and the imbalance between male and female participants played a huge role in significantly influencing the PNSS total score and contributing to a high heterogeneity. Next, another scale with the same function as the PNSS but used more frequently in a clinical setting, the Clinical Global Impression Severity Score, also was assessed. CAR-XT has also proved to significantly decrease the CGI-S score compared to the placebo group, this time with low heterogeneity and a fixed effect model. Although the efficacy of the drug has been proven, side effects have occurred more frequently in the drug rather than the placebo in the form of any treatment-emergent adverse effects, or TEAEs, which encompasses both serious and non-serious side effects in a significant manner. However, specific analysis for the serious treatment-emergent adverse effects, such as suicide ideation, appendicitis, and gastroesophageal reflux disease, have shown to appear more frequently in the drug group in an insignificant manner. Thus, even though the drug has showcased its efficacy in reducing schizophrenic symptoms, does the fact that the frequency of the occurrence of TEAEs ultimately render its use unfavorable? Just to clarify, the majority of the TEAEs developed in just the first 2 to 3 weeks of the trial, and they were transient and resolved before the trial ended. Other than that, the TEAEs that occurred was not associated with the common adverse effect events presented in the normally used antipsychotic medications, such as extrapyramidal motor symptoms, weight gain, metabolic changes, prolactin elevation, or somnolence. Thus, these 2 factors led to a not much different number of trial dropouts between the treatment and control groups and proved that CAR-XT was able to demonstrate efficacy and safety while being highly tolerable by the population. With that being said, the benefits of CAR-XT are, firstly, it provides rapid improvement of psychotic symptoms around the 2-week mark with a gradual increase until the final week. Because of this, it is suggested that a greater size effect may happen in the later points of the trial. Second, it is generally well tolerated without causing dopaminergic adverse effects that are usually the problem with the use of the current medications of schizophrenia. The strengths of this study are that it is the first meta-analysis assessing the use of CAR-XT on schizophrenia patients while also using clinically relevant outcomes, and thus being able to enhance the practical applicability of findings, as well as providing a heterogeneity analysis which can be used to consider confounding factors in future trials. As for the limitations, the duration of the trials were too short to assess the long-term use of a drug with the objective to cure a lifelong illness, which is schizophrenia. Next, the populations used were only from 2 countries, thus not being able to represent a wider range of populations. Furthermore, the trials conducted did not directly compare CAR-XT with other antipsychotic drugs. Thus, we recommend that future trials should be conducted with a longer duration to assess the safety of CAR-XT, with attention to a wider variety of populations and direct comparisons with other antipsychotic drugs, as well as the cost-effectiveness of the drug overall. In conclusion, Xanomeline and Trospium chloride, under the name of CAR-XT, has shown promise in improving psychotic symptoms while being generally safe and tolerable based on assessment from clinically relevant screening tools. CAR-XT, redefining schizophrenia care with breakthrough efficacy and unmatched tolerability. That is all for my presentation. Thank you for listening.
Such an interesting topic. I believe that we all have learned so much today. Do you have any comments or any questions?
Thank you very much for your interested presentation. Do you try to search the article in the clinical trial registry?
Yes, I did.
For which database that you searched?
So,
the unpublished study?
I searched on 4 databases, the clinicaltrials.gov, Scopus, Cochrane, and PubMed.
And in the clinicaltrial.gov, you you found the unpublished study or not, or ongoing randomized control trial?
So far, we only use the currently published studies, which are the 4 studies that I used. But there are 2 ongoing trials which are conducted in a longer duration of 52 weeks, but they are still not complete, so we didn't use them here.
So this trial is not present the result, right? That ongoing trial is not present the result in the clinicaltrial.gov?
Yes, the 52-week trials, we did not use that in the presentation. All of the trials that were presented in the presentation were all 5-week trials, and so they did not really assess the long-term use of the drug itself.
The population that include in the randomized control trial, they are the treatment naive or they are the treatment failure from the from the standard treatment drug. The population, the patient in your included study, they are the treatment naive for schizophrenia or the patient who already treated with the standard medication.
Oh yeah, for the patients, for all of the patients that were enrolled in the studies, all of them haven't been administered with the previous medications that are the standard for schizophrenia. So this is completely new.
And the comparator is just only placebo,
Yeah, only
not
placebo.
the standard treatment.
Yes.
Even though they are treatment naive.
Yes, currently no studies have compared the drug with others, and the first and second generation of antipsychotics, which is probably a recommendation for the future studies.
Do you have any comments? Thank you very much. So this is the end of the oral presentation.